Good morning to the honorable chairpersons on the dais. This study to evaluate the patient of chronic dacryocystitis was done in commission with the radiology department of our medical college to rule out the site of blockage, because dacryocystitis patient or have got a dilemma where the level of block is there. Even with the many investigation which you carry out in a conventional day-to-day activity, we cannot find out the site of blockage. And one of the most important complaint with these patients who had attended our OPD had epiphoria. And chronic dacryocystitis is one of the most common pathology involving the lacrimal drainage system. These are the few of the representation of the patient suffering from chronic dacryocystitis. Exclusion criteria was acute dacryocystitis, because we do not perform these types of tests over there. What is the rationale for performing a dacryocystogram? Because it assesses the functional anatomy of the lacrimal drainage system. It determines the site of blockage and stenosis. It provides us an appropriate detail evaluating the indication of surgery, and also help us to decide the type of surgery which could be indicated in these personnel. Aims and objective are very clear-cut from the very basis, to assess the site of obstruction and to diagnose lacrimal system pathologies like diverticula, fistula, tumors, etc. This is a prospective observational study carried out last year. The inclusion criteria, primary ocular examination, and everything was done according to the ethical committee study which was proposed by our college. After a complete workup and a verbal consent, the AIOC, which is a water-soluble and non-toxic, non-ionic contrast provided by the radiology department, was done. Technique, we are all aware of the technique. A cardwell view was the optimal imaging modality for the adequate visualization of the lacrimal system. I'll show you how it was done. And this was, the film was taken by the radiology resident and the consultant. This is the procedure which is being performed. This is an 18-year-old adolescent girl having complaint of watering. Right eye syringing showed lower complete block with regurgitation of mucopurulent fluid. Dacryocystography to locate the level of blockage. You can see in the contrast enhanced radio opaque films the level of blockage over there. Result, out of the 50 patients, we could advocate only 50 patients because the workload was not so much. Out of the 50 patients, 37 patients were female, which indicate a female preponderance, not documented in much of the studies, but we had this particular ratio. And as far as laterality was concerned, it showed a left laterality, but nothing has been documented to date as far as laterality and of the study is concerned. This is the depiction of the block. The yellow one and the blue one denotes NLD block, and the red one denotes common canalicular and the canalicular block. Maximum cases had block at the level of nasolacrimal duct, and canalicular block was present at the level of 5% in our study. Maximum cases had distended sac followed by normal sac, though the patient had a normal sac. And the bottom line and the thing which we wanted to find out were the fibrosed irregular sac, in which the treatment modality changes dramatically. So we were in a view to find out this particular fibrosed irregular sac also. The surgery, the question was that we'll go for the discussion. 50% of the patients of chronic dacryocystitis were studied between 12 to 70 years of age. Most patients presented with complaint of intermittent conjunctival hyperemia and epiphoria. All patients were subjected to careful slit-lamp examination. And dacryocystrography was performed using Iaxol as radio-opaque contrast, which is water-soluble ionic medium. I think the time is finished, no?
Yes.
The time is finished, sir? Okay. So this for the discussion part on my paper.
You can go ahead.
I can go ahead.
Yes. Sum up within 1 minute, please. Try to finish within 1 minute.
Okay, okay,
Please
fine.
continue and finish
Thank you,
within
sir.
a 1 minute, please. Yeah.
Huh. We had come up to the discussion. Demographic profile of these patients. We have females attributed to narrow lumen of the lacrimal passage among the female. This is documented to a certain extent, but we had this particular ratio of 3.4 is to 1. Laterality, I have told you, nothing is presented in the literature as far as the laterality is concerned. The third topic of discussion was level of block. In this study, the most common site of block being the necrolacrimal duct obstruction, followed by canalicular block. The lumen of NLD being slightly tortuous and irregular leads to stasis of secretion, and as a consequence, stenosis sometimes develop. Agarwal, it's a very long back study. 72 was able to conclude that the major obstruction site was a junction of lacrimal sac with nasolacrimal duct, followed by nasolacrimal duct proper obstruction. The type of block, according to the study, complete block around 75% was found in the majority of the patient, versus incomplete or partial block could be noted in 25%, means the dye was present inside the sac and no movement of the dye due to gravity was observed in 75% of the patient. As far as sac morphology is concerned, in the study on observing the morphology of the sac, 30% showed nearly normal sac. As far as the dimension of the sacs was concerned, 20% showed small, irregular, fibrous sac, and 40% shows a 42% had a distended sac. This is similar to the finding in the study. Enlarged sac was found to be higher in proportion than normal sac. Study by Malik also showed distended sac in majority of the patients with chronic dacryocystitis. Other significant finding in the study, 2 patients had external fistula. None had internal fistula communicating with the nasal bone. Residual sac was noticed in some patients following DCT. There were no cases of filling defect, diverticuli, lacrimal stone, and bone fracture in my study observation. Conclusion: the dacryocystogram is easy to perform and provide good imaging quality. With less exposure to radiation, we have got 128 helical scan, CT scan also. We have got MRI also, but the basic was that this conventional dacryocystrography is one of the modality in which you can delineate the common canaliculi and the canaliculi. Whereas the dye used at the Pector technique scan and other contrast medium used for CT scan, we are not able to delineate the common canaliculi and the upper and lower canaliculi. It was evident from the finding derived from the study that dacryocystogram is a safe investigation modality in hands of skilled ophthalmologists, and it is the gold standard modality for imaging lacrimal drainage system. It aids to localize the level of block and evaluate conclusion that DCG enabled us to meticulously plan the treatment for chronic dacryocystitis and provide better surgical outcomes.
Okay, just please tell me few of the problems with this system, with this dacryocystrography.
I didn't get
You may face there is some drawbacks
Yeah.
of dacryocystrography. Can you please summarize few points?
Are you talking about the level of blockage? Or are you talking about the types of blockage which I encountered?
No, it is blockage, but most of the time it is not required in our day-to-day practice. So, in which cases you will prefer
Acha, in
dacryocystrography?
which cases I have preferred? Sir,
Second one is what are the drawbacks of this procedure?
Sir, we had taken around 50 cases who had a history of epiphora. And they were persistently having a conjunctival hyperemia. It was just a study to diagnose, it was just a study to delineate and diagnose the level of blockage. It's a prospective study which we wanted to for observational purpose. And the patient had the history of epiphora, congenital hyperemia. And we have taken these patients just to have a bird eye view of where is the level of blockage in the patient suffering from chronic dacryocystitis. We just wanted to know what was the level of blockage. That was our aim of the study.
Yes. But there is some other alternate like that we can go for a diagnostic probing. One of the very simple technique diagnostic problem. So
I agree with you. We had done these types of techniques also. We are routinely doing it. We have a paramedical course running in institute.
yes,
We have got 10
as
PGs. We are doing it. But it
that's
was
why
just it was a measure to find out the level of blockage from our side. It was just our endeavor to find out what is the site of blockage, whether and what are the status of the sac in patients suffering from dacryocystography. We were just wanted to find out, and what is the main rationale was to see the status of the sac. In how many patients you have a fibrous sac, in how many patients you have an atrophic sac, how many patients you require a physiological uh, recommendation for MRI and all those. So it was just an opportunity for us to see the status of the sac. That was the main point. Level of black was delineated, and even the status of the sac was also delineated from our side.
okay.